So basically, this is a figure you've seen before that was presented by the WHO. But what we wanted to remind here is as well, like how there's a bilateral relationship between environmental change and health, and also by the fact that climate change is bringing a lot of vulnerability within exposure pathways by increasing diseases and creating a lot of risk on certain diseases. But as these risks and these diseases increase, it is also creating a lot of stress and additional emissions from health systems in of themselves, which means that because more resources are needed, then it is increasing the emissions, and the emissions who are actually exacerbating by on the second time the diseases and people's health. So we're really looking at this bilateral relationship at Sanofi, and what we try to do is really try and bring a diverse and holistic approach. So there's 4 pillars to what we try and do. The first one is obviously to try and reduce the impact of our activities in our products and the environment. As you've seen before, about 50% of the emissions from the healthcare sector also come from pharmaceutical companies. And so our responsibility is first and foremost to try and reduce these emissions. And this is what we're trying. So this is the first thing that we're trying to do. Secondly, we also think that we have a responsibility in terms of bringing innovative medicines and vaccines to protect the patients that are actually being impacted by the exacerbation of certain diseases and by climate change. And this is a key place where by investing in research and development, by bringing innovation to the market, we can actually actively protect additional patients. Another part that we're looking at, and this had been mentioned before, is around driving coordinated action and really insisting on this coordinated action to reduce the health system carbon footprint. Because the emissions in the health system are quite fragmented, they come from a lot of different places. It's only by having this collective work that we'll actually be able to sustainably reduce the emissions. And finally, and Daouda will tell you more about this, is that we work at supporting the most vulnerable population on the adaptation process and really building the resilience of these populations to environmental change. And this is all the work that's being done by the foundation that we have and that we'll talk a bit more about later. So jumping into the first part, I wanted to just say is that the main aim is first of all, for pharmaceutical companies to reduce their own emissions. And this is where we're on a journey. So again, repeating a few of the key messages, but it's really important to say so, is that like we're working towards carbon neutrality by 2030 and as well net zero by 2045. And to do so, there's a lot of key actions that can be taken in terms of so building this carbon neutrality, but also limiting the environmental footprints and building circular solutions for our plants, but also for our products, and really trying to improve the environmental profile of products that we have. There's also a lot of work around mobilizing our people and our networks and engaging with our supply chain. A lot of the emissions, as presented before as well, come from the scope 3, so from all the supply chain and the indirect emissions. And this is a key part in trying to coordinate and engage with our partners to make sure that we're able to actually reach these targets. Jumping to maybe the other pillar, which is around decarbonizing health system. This has been showed before, but really going into a bit more detail. So as a pharmaceutical companies, because we have the responsibility of reducing our emissions and the supply chain part, which is about 50% of the emissions, but there's still about 40 to 45% of the emissions that come from the patient care setting. And there's increasing need and recognition. There's a need as well to act on this patient care setting and how we can actually participate in decarbonizing the patient care pathway all along the journey, particularly for chronic diseases or non-communicable diseases. We also have this need to make sure that as the patient evolves and as the disease evolves as well with the patient, how all along the patient care setting, we can make sure that we're reducing the emissions. And this is a mission that Sanofi is leading as well with a consortium called the SMI, the Sustainable Market Initiatives, which has been created during COP26 that happened in Glasgow, and really trying to work across industry, but public and private sector, to try and make sure that we can reduce these emissions. And as we can't do it alone, we are really looking at 3 different things. So we're trying to build harmonized measurement frameworks, which means that making sure that if there's these measurement frameworks are adopted, if people are making measurements to try and quantify how we can reduce the emissions in the care pathways, that we're doing it in the same way, that we're using the same way of doing it, because then in that way we can all make sure that we're acting and impacting the hotspots, and that we've identified how we can do so. And once we've actually harmonized the frameworks, that we make sure that countries are adopting these frameworks and working in the same way, we can make sure that then we can adapt, and that these care settings can adapt. And to do so, we've identified within the SMI 7 dimensions that are considered as key levers to try and reduce emissions along the care pathway. And prevention is one of the key measures, because obviously, as we arrive earlier on, as we're able to avoid the onset of the diseases, then we can also make sure that it doesn't impact the health system later on. So within these 7 levers, so prevention and disease onset is very key. Early diagnosis, making sure that we arrive very early in the care management, that we improve the efficiency of the intervention, the disease management, and as well, there's 2 key levers that we're exploring is around the proximity and digital care. How can we really bring care as close to possible to the patient? And can we use digital care to improve the health outcomes of the patients? And these are all types of measures that we've seen to have significant impact on reducing the emissions. And to move on, then I'm actually going to jump to let Daouda tell you more about what they're doing in terms of for the most vulnerable populations. And thank you very much, Daouda, for taking this. I can pass the slides if you want to.
Yeah, thank you very much, Priscille. As you said, at the Foundation S, we are focusing more on climate adaptation and health resilience, really looking at how we can increase the health resilience of the most vulnerable communities in low and middle income countries. Basically, we are focusing our work in sub-Saharan Africa and in 4 countries in Southeast Asia, which is Pakistan. As you all know, that Pakistan is a highly impacted country, Bangladesh, Nepal, and Cambodia. So when we just at the inception of the foundation, when we just decided to focus our work on climate adaptation, what we did is that we hold a series of consultation, and co-creation with people and organizations that are from communities and countries that are highly impacted by climate and health, to better understand what the needs are, but what the local solutions are, and how what potential we could see in terms of scaling up and also replication in a way that will bring more impact at community level. So we end up focusing our intervention at Foundation S in around 3 pillars. One is how do we sustain, how do we strengthen local and community and locally led adaptation initiative and program, and how do we also contribute to build their health resilience as they are confronted to the impact of climate change. The second, and I will come back on it, is how do we contribute, because I think one of the colleagues said it, and it's so true. Climate information and information related to the response and the consequences and the best practice when responding to climate challenges at community level is also extremely important. It's important to have hardcore data, and we are privileged to have the Lancet countdown report. We also have other data from different academic institutions. But what we are lacking is real-time data and data from the real world and how people themselves are being confronted and what are the solutions they're developing that can also help for the global response to climate. And finally, we focus our effort on rallying and building a collective movement. To put health at the center of the climate agenda, which is now beginning to be a reality, and we are privileged to have a health day during the upcoming COPs. But more importantly and more in detail, how do we mobilize all our effort for financing climate adaptation? I think we are not there yet, but this is also one of the key aspect of our work. So I want to focus on the first pillar, which is really how do we build resilience at community level and how do we support all of the effort that communities are also deploying to adapt, to prevent, and to protect their belongings and their life in the face of climate crisis. This is done through different channels of support and funding. We are funding direct local intervention and locally led adaptation through direct granting. This is done through a call for proposal. Last year we have our first proposal, and we received proposal from 30 countries out of the 31 countries that are the most vulnerable to climate change in the world, and we end up through a very rigorous process of selection. We have selected different projects from 17 countries around the world, among the most vulnerable countries. We're also looking at local solution, local innovation that are very local but has a potential to be very impactful and to be duplicated or scale up at another scale. This is what we call innovation and local solution funding. But we all know, we realize and we are conscious that we are based in Paris. We are Paris-based foundations. We are not present in the field, and we also know that supporting local response and locally led adaptation will require very close oversight, will require capacity building, will require responding very quickly to the needs of communities as they are confronted to climate and health challenges. So that's why we in each of the region we are working with what we call regional climate action regional accelerator. It's a organization that has a presence in the region or in a country that have proven experience to support local response to health, to support also the primary healthcare system as well as the community system in health, and who also have shown their experience in building the capacity to take to scale the most promising responses. And finally, we are also working with to develop strategic partnership with different key stakeholders that are working on global health and who wants also to invest more on climate and health. So this is an example of what we've got in terms of outcome through one of the vehicles that the foundation is using to fund climate adaptation and health resilience, which is the call for proposal. So we receive several and hundreds of projects. Amongst them, we've selected 22 top projects, and we have also our 2 regional accelerators that are really focusing in to provide support, oversight, capacity building. They are also mobilizing research institutions to really work with communities that are responding to climate and health through the approach of implementation science. So we are trying to really embed research into the implementation of climate adaptation programs. So what was also very interesting, and I wanted to emphasize that, is the variety of response on climate and health, and the richness of the solution that people come up in their project to adapt and to respond for a long-term resilience to climate and health. We have received projects that focus on really building a community health system that is resilient to climate change. We have also, for example, in the north of Burkina Faso, where communities are confronted to drought, at the same time of confronted to flooding that are coming quite rapidly. They come up with a very strong early warning system and anticipatory actions that communities themselves can do to be better prepared. We have in Ghana smart agriculture, very woman-driven smart agriculture program to guarantee food security and access to water in the region, as well as a good number of projects on climate sensitive disease and how to prepare and how to build the capacity and the resilience of the health system to deliver services that will also mitigate the impact of climate on infectious diseases and other diseases. And last but not least, really we have seen communities preparing for repetitive heat waves and the impact on maternal and child health. It was not obvious to understand that, but listening to people and looking at their proposal, you can easily relate how the heat waves are impacting very directly the life of pregnant women, the children as well as women in general. So you could see on your right the number of countries where program and projects have been selected, and you can see in the map also where we are trying to have program being selected. And it's only going to be bigger because in December we are going to launch a new call for proposal to continue to fund locally led adaptation program. This is, and I'll finish with that. This is also a report that we have we've launched during ANGA in September, which is really providing insight, reflection, strategic direction, and clear and concrete example on how we can accelerate the global response to climate and health, focusing on locally led adaptation and building the capacity and the capability of communities to prepare, protect, and adapt to climate change, as well as how do we better leverage finance to really support climate adaptation and health resilience in low and middle income countries. I will be very happy to share this report, which has been also have very high level and high profile personality and giant in the healthcare system that has also contributed at the sidelines of the work that we have done with communities. We could see you can see in the report that we are also trying also to emphasize the wisdom and the experience from communities while they're confronted to climate change, and how they're developing innovative response that can help all of us to better respond to the impact of climate change on health. So I'll stop here and thank you very, very much.